Our next CONy meeting, which is an annual meeting, will take place in exactly 2 weeks from now on March 23 up until March 25, and will take place in beautiful Dubrovnik. And always, we expect a large crowd. And of course, these are clinical neurologists who are interested in many topics. And we have many channels to discuss. So there will be parallel halls, 4 parallel halls. And in each of these, we're going to discuss various issues. But the difference in CONy versus other congresses is that here you don't see just one view of every topic, but rather a debate. So everything is a debate. It starts with the moderator who introduces the subject and the 2 opponents, one saying this and the other says just the opposite. So after 1 hour, you come out and you know all the issues. You know what is for and what is against. So, for example, in the headache field, everybody knows that the new issue is the CGRP antagonists, and the question is any of them better? How should they be used? What are the contraindications? What are the side effects? And we're going to discuss this. So are the oral CGRP antagonists better than the injectable ones? Is it that you start with one and you think that you should switch to another? Is it logical, or does failure of one give you a class effect that none of them will work, and so on and so on. So with the triptans, we are very careful with people who have cardiovascular events or cardiovascular risk factors. With CGRP, we don't know yet. So again, are CGRP antagonists contraindicated in people who have these effects? So in each of these issues that I've mentioned, we have a proponent and an opponent. Each of them has 15 minutes to present their case, and then there is time for questions and comments, and then we vote. Of course, we voted before for A or B, and then we vote after the issues were clarified, and again we see whether there was any change in the opinion of the attendees. So, and this we do in Hall A for headache, in Hall B for stroke, Hall C for multiple sclerosis, and so on and so on. So we go along and discuss each of these topics in sequence. So in each of these topics, like in headache, we have about 8 to 10 pro-con debates, and the same is also true for the others. We have a lot of discussions in Parkinson's, a lot of discussion on stroke. Epilepsy, of course, is a very important and popular topic to discuss, and so on.